Hey, I'm EJ. I'm a queer, non-binary person, a leader at Avivo, serving as the Service Area Director for Community, Chemical, and Mental Health, and my pronouns are they, them.
Hey, and I'm BJ. I'm an Asian American, son of a Vietnamese refugee, and I'm the Program Director for the Mental Health Clinic and Targeted Case Management Programs here at Avivo.
So today, we're with you because it's Give to the Max Day, which is Minnesota's single biggest day of nonprofit giving. We're here today to talk about one of the ways that Avivo is prioritizing justice, equity, diversity, and inclusion.
This is important to us because people from Black, Indigenous, people of color, immigrants, and LGBTQIA communities are underrepresented in the mental health field.
Yeah, many BIPOC and LGBTQI people avoid mental health treatments because they can't find a provider that looks like them, a provider that they don't have to teach. And so this program will look to help solve that in our own organization and beyond.
Most people don't know about this Avivo program, and we're excited about it today. We have over 14 staff currently participating, and 3 Avivo staff who are part of this program are just standing by.
In the next few minutes, you'll learn more about the Diversity Workforce Program and also why it's important to Minnesota.
You'll hear from 3 amazing members of Avivo's mental health services who participate in our workforce diversity.
BJ, let's pass this over to Carvey, Ayana, and Naima.
I would say the Diversity Workforce Program is about reaching out and really helping individuals of color kind of reach that, whether it's a goal of helping provide or be a part of the change with providing services to individuals that look like themselves. So the program really helped folks of color, LGBTQ, to access licensure in mental health services. This has been an amazing opportunity, and I'm really grateful that I have been at Avivo to be one of the recipients of it. It's been a blessing.
I would say when we look at historically the populations that are served by social services as well as behavioral health services tends to be communities of color as well as those who are members of LGBTQIA. But when we look at the providers that are available to those communities, we find that there are much smaller numbers of individuals that represent those communities serving the population. When providers of color are able, or even providers from the LGBTQIA community are able to give services to those in the community, we see that there are higher levels of functioning, that there is more empathy.
This program matters to me because it supports my mission and goal to work for a community that I represent. There is a lack of Black mental health professionals in the nation, and I take it as my goal to reduce that overwhelming gap. So currently I'm doing my internship at Avivo, and I'm getting the stipend internship, which means that I get paid. Great for me. Being a mom, I can maintain my finances and also receive the education that I need to become that Black mental health professional. It's allowing me to become that person that they can rebuild their life with.
I have families and friends who's impacted every day, and it's so hard for me to find someone who get it or who understands them. And so having the ability and having the resources to be one of them, be one of that person who can be a part of the change, who can tell someone it's okay and listen and make them feel comfortable, this is why it's important for me.
This program actually provided a way for me to receive 2 licenses in regards to being able to pay for my first one, then reimbursing me so I could pay for my second one. The other thing that I've gained from being in this program personally is just having a group of people that I can rely on and get support from, and having this camaraderie amongst us that makes me feel like I belong when sometimes you can feel like the outsider in these professions.
Since I graduated from this program and became a licensed social worker, I've had a lot of my staff who are folks of color come out to me and said how proud they are and how now they really want to go back to school.
Thank you for tuning in, and thank you to Karvi, Ayana, and Naima.
And remember, if you're interested in supporting Avivo on Give to the Max Day today, you can support Avivo by following the directions on the bottom of your screen.
I got a license. I'm a social worker. I'm a licensed social worker.
I'll just point to my license too. Got my license.
Did you get it?
Yeah, girl. I got both.